Hello and Assalamu alaikum. Ultrascan diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper and the lower jaws. We can clearly see that the patient has multiple BDRs in the upper right quadrant, impacted wisdom teeth. We've got multiple BDRs in the upper left and the lower left quadrant as well, with impactions of the wisdom teeth in the lower left quadrant as well. Now, taking you to the panoramic view, on the panoramic view, we can clearly see that we've got a root canal treated tool, which is part of which is the distal abutment on the right hand side of the bridge. There is a periapical radiolucency, a central incisor non-root canal treated, and a central incisor on the left hand side is root canal treated and is also the mesial abutment or a distal abutment on the left hand side. So this is the tooth. As we can see, we've got a canine there. We've got multiple wisdom impacted on the top right and the bottom right, and we've got an impacted wisdom on the bottom left. We will take you to the transaxial view for better understanding. This is the transaxial view of the upper central incisor. It is part of the bridge. The central incisor is non-root canal treated. We don't see any periapical radiolucency. We move on to the lateral incisor. The lateral incisor is root canal treated. We can see that the obturation is short and we've got a well-defined periapical radiolucency. Here we can also see that the tooth, the crown portion of the abutment is disintegrated, and the crown or the part of the tooth, the retainer, is not seated very well on the tooth. The canine appears to be normal, non-cavitated, non-radiolucency, single canal. The first premolar is BDRs. Here we can see that the ridge is significantly thin in this region. There we go. We've got a 6.9 mm ridge, and we've got approximately 13 millimeters of ridge height in this region. Moving to the second premolar, this is also a root canal treated but also a BDR. Here we've got approximately 8.5 mm of ridge width with approximately 8 mm of ridge height. Moving to the first molar, this is also a this is the parietal root which is separated. We've got the mesial and the distal roots are also separated. We can see that there is a little bit of a depression here on the upper parietal area. The ridge width in this region is going to be approximately 11 mm and the ridge height in this region is going to be 7 millimeters. The second premolar is slightly better in its actuality. We can see that all the roots are present. We've got the chamber. It is grossly carious. This is the upper right wisdom tooth, right impacted here. It is buccally tilted, as you can clearly see. Has not caused any sinusitis in this region yet. Now moving to the upper left hand quadrant. So this is the upper left central incisor. There we go. All right, the upper left central incisor is definitely root canal treated. Has a periapical, very well defined periapical radiolucency because the obturation appears to be short, even though the retainer is sitting very well on the abutment tooth. This is the lateral incisor. The lateral incisor is also significantly, it is grossly carious. We don't see any significant crown structure. We also cannot see any periapical radiolucency. Moving to the canine appears to be doing very well. No periapical radiolucency, no carious lesions can be detected. This is the upper left first premolar region. This is the first premolar. As you can see, again, very grossly carious, don't have any significant bone dimensions here either. We've got 8 mm of bone height with approximately 11 mm of bone length. Moving to the second premolar, we've got a very insignificant BDR, but the height of the ridge is going to be 8, the width is going to be 8 and the height is going to be 9 millimeters. Moving to the first molar. The first molar, we've got very disintegrated roots. We can also see major periapical radiolucencies. The approximate width is 9.7 with the height being 9.1, but the quality of the bone is D4 in this region because you've got absolutely no cortical plate and very radiolucent cancellous bone as well. Here we can see that we've got the BDRs, they've been changing the morphology of the bone. You've got cortical disintegration in this region. Moving to the upper left wisdom, again we can clearly see that there is no cortical bone support, and this is the just next to the tuberosity area. Now, we've done the upper arch. We'll move on to the lower arch for our doctor, and then we'll take you through each. This is the central incisor on the this is 3-1. Moving to 3-2, we've got 3-3, 3-4, and then we're moving to the molars. Again, we see significant BTRs here in the molar region. The quality of the bone here is D1 because we've got very opaque cancellous bone. The ridge width is 9.2 with ridge height being 13.5 to 15 to the inferior alveolar nerve, with approximately 12 for implant placement. Moving to the second molar region, again, just BTR is very superficial. The bone width in this region is 8.2, with the bone height being approximately 13, and the bone quality being D1 here as well. This is the wisdom tooth. It's horizontally impacted, does show a little bit of a radiolucency, but is very significantly far away from the inferior alveolar nerve. Now moving, this is the lower right canine, again grossly carious, periapical radiolucency is present. This is the first premolar region. Here again we've got very superficial BTR. Bone width here is 8.1. Bone height here is 12.2. And but to the inferior alveolar it's 15. And the bone quality here is also D1. This is the molar region. Here you can see that the bone gets very angulated, and here we don't have significant bone height. It's 8.1 of 8.3 of width, but approximately just 9.6 of bone height because this is very angulated bone. The wisdom tooth on the lower right hand side is in very close approximation to the inferior alveolar nerve. This is very significant. I'm going to zoom in for the doctor. Here you can see this is the orange marking is the inferior alveolar nerve, and as you can see that the inferior part of the lower right wisdom tooth compresses the wisdom tooth right here. It compresses the inferior alveolar nerve canal. Sorry. So I'm just going to remove the highlight. This is the inferior alveolar nerve canal. As you can see, it is not in its usual rounded shape. This is how the canal should be. It should be round, should be far away from the nerve. But as we move towards the tooth, we can see that the nerve in the nerve canal becomes kidney bean shaped, gets very severely compressed. And this is how we know that this wisdom tooth is in direct contact with the inferior alveolar nerve canal, and extraction of this said tooth can have consequences to the inferior alveolar nerve. So if there are any further questions, this was a very comprehensive CBCT. So if there are any further questions regarding this case, please feel free to reach to our team. We will be extremely happy to help. Just to give you an idea of how the canal is the very different, how the morphology of the mandible is different on each side. So this is the left hand side, this is the right hand side. If we slightly zoom in, so we can see that how the canal morphology changes and how there is a very severe depression here and angulation because of the ridge height not being adequate on the right hand side. And this is how the nerve interacts with the lower right wisdom tooth. Thank you very much.